Okay. Welcome everyone to our Lunch and Learn for September. We have both Phil, if you could come on camera. Phil is a DPT here at our South Oxnard clinic. He did his ATC at Colorado State University, Pueblo, and then went to DPT school at St. Augustine. Graduated 2020, and he was actually an aide at the performance clinics here in Ventura for about 5 years before he came back as a PT. So that is awesome. And then we have Jim Magnusson. He is a PT as well, graduated from Cal State Northridge a couple years ago. And studied under Rick Cass while he was there too. Rick Cass is actually a professor of his. So welcome back to the Spine and Sport family. And so Jim has started a firefighter wellness program in 2001 and currently has over 180 firefighters a part of that program. And so we're going to tell us about the program today. In the chat, I'm putting our objectives. So we are going to provide a history of the firefighter wellness program here in Ventura County, describe the process of our part in that wellness program. He's going to provide an outline of the annual physical assessments, and lastly, describe the testing process and multidiscipline approach. So I think this is a topic that actually covers an interest for a lot of our regions. We've done similar things in San Diego with fire academies, up in Sacramento. They also help with firefighter wellness, injury prevention, and rehab. So really fun topic. Thanks for agreeing to be our speakers today, Phil and Jim. I'll turn it over to you.
Thanks, Sharon. And thank you all for giving us part of your lunchtime for me to see how my IT skills are here. I think you got it, Sharon. Okay. So hopefully you guys have that first screen up there. Again, thanks for introducing me, Sharon. We have 4 people on staff with the Performance Wellness Program. Myself, Phil is the Vice President, Justin Reading, who's a head athletic trainer at the Mamba Sports Academy here in Newbury Park, and Melissa Davidson, who's an independent contractor. She's our registered dietitian. So going forward, when we first started the firefighters, we do different types of testing at different times a year. We do an annual test, obviously by the name, it's done annually, and we compare the firefighters versus themselves every year. We then also do a quarterly or a biannual assessment depending on the city. So Ventura City, we do quarterly. We go out there every 3 months and meet with the firefighters. And then on Oxnard, we do biannual. And then lastly, we do office consultations for all firefighters. So it took a couple of years to gain their trust with this. First couple of years, I didn't see a lot of the firefighters in the clinic. But then by about year 3, the guys were coming in pretty regularly. They'll stop by before work. I get in here early, so I see them before their shift, and then they go do their shift, and the next crew comes in when they're off shift. So I tell them to utilize our clinic as a training room. I'm also an athletic trainer, like Phil and Sharon. So they get the idea. You know, if you're an athlete and you get injured, there's usually a place to go to, like the training room. So that's kind of how we approach it with firefighters. All right, so the thing that we pound early and often with the firefighters are cardio, because they have the highest occupational fatality rates due to coronary artery disease. Firefighters at 44%, police at 22%, and EMS workers are at 11%. So one of the things that we're kind of pounding early on in this program is to get in shape and see if we change that number. The role of the wellness program, like Sharon said, we started testing in 2001, so that's 20 years ago, with the idea of preventing injury. So as an athletic trainer, we always are thinking about how to prevent the injuries on the field, and also as a physical therapist. Now we would turn that more toward the industrial athlete firefighter. And I also work with the police department in town in doing that. So I'll just say public safety to do a catch bag of that. Also to decrease disability from injury. So as an athletic trainer, when we're working on football field, we know those athletes that are in better shape typically have less disability from their injuries. They return to sport faster. And lastly is expedite treatment of injuries. So for a long time, firefighters would get injured, they'd put up with the pain, and then you'd end up with not just a shoulder injury, but you'd have a neck and a shoulder injury. Or if you had an ankle sprain, you had an ankle and a knee and a hip and maybe a back because they're compensating their gait. So our whole idea was to get them in early, get treatment early on to prevent any residual problems. Historically, wellness programs, this has been since I started, and probably you too, Joe, way back in the day, that wellness programs go based on how the economy goes. So if the economy is going good, employers, companies are making profits, and they share that in the form of increased benefits to their employees. So wellness programs were pretty good early on. Then when the corporate hit a little snag, the first thing to go was the employee benefit of the exercise portion of that, or wellness programs. So the tangible benefits, obviously, improved productivity, reduced absenteeism, lower turnover rate, reduce injury experiences, because if you have a physically fit employee, again, they're probably less likely to get injured, and if they do get injured, there'll be less disability from that because they have a muscle buffer. So the intangible, improve employee morale. So with the fire department, usually you have between 3 and 7 firefighters in a station at a time. So that creates a group mentality. So if the chief there is into, or the captain's into exercising, the crew generally exercises. If the captain's not into exercising so much, that crew tends to kind of stray away from that a little bit. The ultimate goal of this joint labor management wellness fitness initiative, we'll refer to as the WFI, the IAFF, the International Association of Firefighters, and the IAFC, International Association of Fire Chiefs, got together back in the 90s and created this initiative. Basically, it's to improve the quality of life for all firefighters. And by doing that, they wanted to spread it across the United States. They started with pilot programs in Phoenix and Los Angeles and Boston, and then ultimately rolled it out to all the fire departments. This is not a mandatory program for the fire department, so it's imperative that you're not just going to the freezer and getting the box every time you see them, that you're doing something that's interactive and interesting to them, because otherwise they'll fall off. There's no motivation to continue. But for our involvement in them, Phil and I have been trying to do a lot more stuff to challenge them. The IFF and the IFC, the Wellness Fitness Initiative, looks like this. There's a medical component, which was Coastal Occupational. Terry Dillon was our medical director. Dr. Dillon did a great job for 20 years helping us out with that. The fitness rehab portion, that's myself and Phil. Data collection is also myself and Phil, as well as risk management at the city, and AIMS, who is the local work comp carrier for the city of Oxnard. The justification comes out of the data collection. So basically they look at the work comp money spent over the years and kind of see what the trends are. This was an interesting study that we did a couple of years ago. Performance Therapy partnered with the City of Oxnard Fire Department and Skidmore College, and we were looking at heart rate responses to alarms. This is a great networking opportunity for us. I was at a conference in Chicago, Redmond Symposium, and I ran into the representative for Globe that makes some of the equipment for the firefighters, and exercise physiologist who was at Skidmore. And we just started talking at a display table. And they said, wow, I wish we could find some firefighters to go through this program so we can validate, why staying in shape is important, and kind of see the physiologic effects of people not being in shape responding to alarm versus those in shape. I said, well, at that time we had 80 firefighters. I said, I bet you I can get at least half of them in that. But we don't really have anyone that's not fit. And they're like, yeah, right, we'll find somebody. So they came out from New York. We met for a week. We went through all our stats and stuff. And at the end of the day, they really couldn't find anyone that was in horrible shape. They were hoping to find someone that's overweight, eating donuts and whatnot. But luckily, we didn't have anyone of that nature. This study went on for a while. You can see down on the left-hand side that it's a shirt that the guys, one of the firefighters wore. It had a little iPad puck that connected to the shirt. It was nickel conductors. We had a couple episodes of skin irritation from that. And we were beta tests, so they're kind of trying to weed all that stuff out. But at the end of the day, the summary of the report was that firefighters who were on more than 5 years didn't have as elevated a heart rate response to certain calls, which is kind of like but it's, again, you do a study to prove that. And there's certain types of calls. So if there's a medical call versus a fire call, heart rates would get elevated across the board as the call came across it was fire related. One of the good things that came out of the study is that I would parse the data. That's that data underneath the picture of the guy on the shirt. So I would parse those every morning. So I'd get calls from the guys saying, hey, at 2 in the morning, we responded to a structure fire. What was my heart rate? So we were able to see their heart rates in real time, and then the EMS coordinator coordinate the calls with the time, and we could really lock it down. One of the guys went from 60 beats per minute sleeping to 180 beats in the span of 5 minutes, and he hadn't even started fighting the fire yet. So he said, oh, that was when I saw the flames going through the roof when we were about a block away. Then his heart rate actually went up to 209 while he was fighting the fire. So when we look at different heart rates that we're kind of assuming that these firefighters get, we have to take into account that staying below 85% of their target is probably not an accurate reflection of what they actually do on their job. And getting the heart rate elevated is something important to get them back safely to their work. All right, let's talk a little bit about equipment stress. So the PPE, we've weighed guys different times, and different guys, firefighters have different tools that they put in their jackets, so it can weigh anywhere from, I had a firefighter in here yesterday and we weighed his was 35 pounds, but that's really without any equipment on it. So that coat and the pants are really heavy. So when you start adding all this other equipment, you're not even talking about a hose bundle that's another 35 pounds. You can see how that's in excess of 70 pounds on their back when they're working. So when we look at how much it takes for them to do their job, if we're exercising them in the clinic trying to get them back to firefighting, but they're in their shorts and tennis shoes and t-shirt in our clinic, that's okay initially, but eventually you want to get them in their real equipment. You want to get them in turnouts exercising in your facility so that they can experience and get that heat tolerance up. So testing. So moving on to testing, we'll go through the components. This is all in the Wellness Fitness Initiative, and we've adapted some things to test other areas. I always like to do, from a body composition standpoint, we use the calipers, the little pincher things. It's not the most accurate, but it's a great field study, a field tool to use because you can take it anywhere. We also do waist to height measurement and BMI. And we put BMI in there. We all know that BMI is not the most accurate measure of obesity-related potential for individuals. Waist to height is, but one of the fire chiefs a couple of years ago said, hey, why don't we include BMI in this? And so we put it in there, but in probably about 80% of the guys, when we do their annual report, it's that their BMI is unhealthy, but their body fat's like 12%. So we go to the waist to height. The waist to height is 0.48, which is in a healthy range. And we tell them, don't worry about the BMI. If anyone gives you a hard time about the BMI, refer to me. But then it's interesting when we do get the calipers, if we measure their body fat at like 16, I always tell them there's a variance there. Obviously the gold standard's underwater weighing. But then I pull out this picture and kind of say, okay, if you look in the mirror, don't forget what I told you, but look in the mirror and where would you fit in those pictures? And some of the guys are thinking that they're like 10 to 12%, but they're looking 25%. So it's kind of hopefully a wake up like, oh yeah, I could stand to lose a couple lbs there. All right, so now I'm going to turn it over to my right-hand man, Phil Long, and he's going to describe the testing procedure we do. Thank you.
All right. Oh. All right, so next what we'll usually do after we do some of the body fat testing is we'll go into an aerobic capacity testing. And what we like to use is the Gherkin protocol. It was developed by Dr. Gherkin. He's out of Arizona, and he developed this protocol specifically for firefighters. So it starts with a 3-minute warm-up, walking at 3 miles an hour, and then at the 3-minute standpoint, or at the 3-minute time period, we then increase that to 4.5 miles an hour. Each minute after that, we then either increase the speed or the incline by 0.5 miles per hour or by 2% incline until we get to 85% of their max heart rate. What we like to do is we like to use a chest strap and a watch just to make sure that we're watching their heart rate accurately throughout the test. Typically, you know, we'll see guys go anywhere from 6 minutes all the way to 14 minutes, maxing out the test. And what they're running at is usually around 7 miles an hour at a 10% incline at the end of maxing out that test. So it's a pretty tough test if you do it all the way to the end. This gives us a lot of really good talking points for the guys, especially if they're about to head into an academy, to kind of give them a better understanding of some of the stuff that they need to train for to prep and get ready for the cardiovascular load. Next, after that, they're warmed up a little bit, so we get them going on a sit and reach test. What we like to do is just have them pop their shoes off and then put their feet inside the box, and they'll perform 3 tests, kind of the same standard test that you would see in a high school setting. But what it does is it gives us a lot of really good talking points as far as mobility for these guys. Some guys will push it all the way to the very end and their mobility is really good, but some of the guys could stand to, work a little bit on their mobility program and would probably decrease the likelihood that they would have some low back injuries or some injuries due to repetitive lifting in the academy or in their work. Next, what we'll do is we'll go into our strength and endurance. So for our strength and endurance testing, we have a plank test, a wall sit test, a push-up test, a grip strength test, and a waist to shoulder height lifting test. So for the plank test, it's exactly what it sounds like. It's just a nice isometric hold for anywhere up to 4 minutes. So what we're doing is we're taking a look at their form as we're going through and performing the test. If their hips are going too high or too low, we generally give them one correction before we stop the test. And a lot of times the guys will be, getting pretty fatigued and they'll try and push it as much as they can. So they'll be shaking. And then usually once they start shaking, we get to the point to where we're stopping the test as well. For the wall sit test, what we do is we will get the guys as close to 90 degrees into a squat as we can. And we like to use a stability ball. That's what's shown in the picture, just because it makes it a little bit tougher. Same sort of idea as the plank. It's just a nice isometric hold. And we go for anywhere up to 3 minutes. For the strength and endurance testing for the push-ups and the waist to shoulder height, we like to use a metronome. So for the push-ups, we'll go at 80 beats per minute. And what we do is we'll pre-measure the guys with a towel roll and try and get their elbows as close to 90 degrees as we can before the test. After that, we start the metronome and they try to get as many push-ups as they can until failure. And at the failure point, it is where we mark it, and we can compare that from year to year. For the grip strength testing, we use a JMAR. So it's just a nice little grip dynamometer. And we can compare symmetry-wise what their grip strength is looking like compared from right to left. This is also a really good screening tool if some of the guys have injuries. And when we can use this as a way to either refer them to a doctor that they're saying, or maybe recommend that they come into the clinic and maybe get treated with some physical therapy. The last one for the strength and endurance testing is going to be the waist to shoulder height. So we just do a bicep curl test. And again, to keep it nice and similar from year to year, we use the metronome. So this will be at 60 beats per minute. And we'll put the guys against a firm surface where their back is resting up against the wall. And they'll just go up on the beat and down on the beat until they finish the test. So the max repetitions on this is 20 repetitions. But what we try to do is get the guys failing anywhere between 8 to 12 reps. Because then we'll plug that into a 1 rep max equation, and that can help us kind of compare them year to year. Some other stuff that we started incorporating this last year is a force plate and Nordic hamstring testing. This is some pretty cool stuff that we use to sort of compare asymmetries and strength, so going from right to left. And this kind of brings up different talking points as far as some of the guys who may be weak from side to side, and in different ways that we can program and maybe prescribe some exercises to get them a little bit stronger. And then finally, the other thing that we added kind of in this last year is the Fms screening, or the functional movement screening. We usually take one of our quarterlies to go through all the tests, but in this last quarterly, we did the inline lunge and the step over test just to kind of introduce it to one of our fire departments. It's a great way for us to kind of take a look at how the guys are moving and see how their mobility is. What we've learned is a lot of these guys are really good at the cardiovascular and strength testing, but they could stand to probably do a lot more mobility, and that's where we come in handy to try and help these guys out. Oh, we got a nice video. That's nice. You guys get to look at my terrible form. All right, so now it's going to go back over to Jim, and he's going to talk a little bit about prevention.
All right, thanks, Phil. Good job, buddy. So what, on the prevention side, we're trying to prevent injury to help them to withstand trauma. So me being a Michigan fan, I had to put an Ohio State player on there, and I don't know if that's their shot, but that's his helmet up in the middle spot there. So hopefully Michigan can come through this year and beat Ohio State. But again, it goes back to being an athletic trainer and taking care of the football guys, is that we want these guys to be in as good physical shape, because you'll see in the pictures coming forth that their job isn't easy, and it's under load, and sometimes at 2:30, 3 in the morning. Prepared through strengthening. So this is some of the stuff we've done. We go out to their gym, and we do use a gym ball. They have traditional weights and stuff, and we run them through a circuit. We get 4 or 5 guys going at the same time. Have a real good time. Usually music's going and guys are challenging each other. Through strategizing, just a brief story here. This is about our 2nd or 3rd year in with these guys. In the middle picture is a picture of the stair chair. So a couple of captains were nice enough. The one sitting down was kind of grumpy, so you could see his posture. He wasn't happy to be in the chair. But you can see by the stair chair, the guy that's on the far right picture, his posture is not bad, but the guy that's on the top has to bend over. Well, we presented this to administration. Long story short, admin was already in the process of buying new stair chairs. So we were concerned about that because we asked them what things really challenge you from your back standpoint, and that was one of them. Through stretching, we all know that stretching, you can 50-50, you can find an article that says it hurts, an article that says it helps. But ultimately, I figure, what are you doing that stretching for? If we're in therapy and we're gaining range of motion, we have to gain proprioception and control that new range of motion. Whereas if you're just stretching and you send someone out to play without any kind of coordination or proprioception, you're going to get more injury as a result of that. So I kind of lean back on my athletic training experience and say, okay, well, they're paying these athletes millions of dollars. And if you go to the football games or baseball games early, what are they doing? They're doing dynamic and static warm-up before they play. So if it doesn't work, why are $1 million athletes doing it? So body mechanics. I wanted to just cover this picture real brief. I know we only have a couple more minutes. I want to open up for questions. But this was a picture I pulled. Unbeknownst to me, some of our firefighters were actually on this call. This is the bridge up by Santa Barbara where a vehicle had come over the edge. Below the gentleman who's horizontally leaning is the 101 freeway. So that drops straight down on the traffic. Luckily, they did stop traffic on either side. But my point here is we pound in body mechanics. Hey, you got to, use your legs when you lift. Keep your back upright. Well, this is the functionality of that. So hopefully that guy that's horizontal, that he's got into that posture before, and he's able to tolerate that. Otherwise, he'll be in the clinic on Monday morning. Dietary stress, our registered dietitian goes over that with them because a lot of these guys will just grab what's quick and easy. And so right now we're going through a phase, I think in the last 5-7 years, firefighters that are way more interested in their nutrition and health than had prior. So Melissa covers that with them. Phil's going to briefly talk about the Orange County Fire Authority study, and then we'll open it up to questions.
All right, I'll try to be quick. So we like to start before each academy talking about hydration. So we start with the study where 126 firefighters at OCFA participated in the study, and they were asked to ingest a core temperature capsule, and then 2 staged fire drills were performed at that for about 30 minutes each. So participants weighed in and were asked for a urine sample to test their hydration, and then vitals were taken before and then also after. And then after the completion of both drills, vitals were taken again, and then a variety of cooling measures were performed. So what they found with this study is that 90% of the participants were dehydrated prior to even beginning the study. So that is really important for these guys to know that they need to be hydrating throughout the academy and kind of throughout their time while they're working. Wet towels are the most effective at cooling the body, and the average weight loss from the drill was around 3 pounds. And that was a total of 30 minutes, so it wasn't a lot of time. We then usually give them this stat, which is dehydration by 2 to 3% of body weight can result to a 7% drop in physical performance. For a 175-pound person, that's only 3.5 pounds of water loss. So if we go back to that study, that was done in 30 minutes. Imagine what's happening to these guys over 45 minutes of continuous work, kind of in bouts throughout the day. So we give them a nice little hydration checklist. So monitor morning weight to check overall hydration status, monitor the color of your urine to check hydration status, weigh before and after exercise to determine fluid needs and losses during training, hydrate during exercise with sports drink that contains sodium, and consume salty foods and salt foods if you're a salty sweater. So these are all just good tips to kind of help these guys get through the academy and helps them differentiate a little bit. Finally, this last slide kind of just goes into the timing of what your body needs during different times of exercise. So if you're working out for less than 45 minutes, normally you can kind of get by just supplementing with water. Anywhere before or anywhere in between 45 to 75 minutes, we recommend that maybe a carbohydrate drink, something that the body can use very quickly, is a good thing to use. And then anywhere in endurance, where you're 1 to 2.5 hours, some sort of food that is dehydrated a little bit slower by the body and by your stomach may be a little bit more beneficial. And that's that slide. And now we'll kind of open it up for questions.
Good job, Bill.
Yeah. You guys can feel free to use the chat or unmute yourself to ask a question or a comment.
There's someone in the chat already.
Just me.
Oh.
I'll monitor the chat.
Come on, Joe, no questions?
No, actually, a lot of the stuff is very similar to what we've done. We started in 2006 with the Wellness Fitness Initiative. We actually helped get about $1.5 million to the city of San Diego, and that's how the program got started. And then it's been funded ever since. Now, we're not involved with the city San Diego Fire Rescue, but we're involved with several other fire departments. A lot in Florida because that's where our person went to, John Mayer. One of the things so a lot of stuff that you're doing is spot on. I mean, this is great stuff. So congratulations, by the way. By the way, it's not easy to get their trust. It's not easy to get these contracts. It's almost next to impossible. So, my hat's off to you. One of the things that we have done is we notice, if you notice to the Firefighter initiative, what's our #1 injury per the NFPA? And what's our #1 retirement injury for firefighters?
Got to be low back, right?
Right. Do they measure anything for the lower back?
No, we've talked about doing that Sorensen. I don't know if you're familiar with the Sorensen test.
So that's how we ended up getting most of our grants, is by implementing that, because we published that out of 900 firefighters, within a year, if they had a low Bjorn Sorensen score, they would have a significant injury that would put them time off work and that would require treatment. So the Bjorn Sorensen, it was our modification. Just like you said that you did a modification, that's what we did, is we added that, and that helped us to get a lot of grants because we got a lot of play out of it.
Now, did you just use a chair device, or how did you do that test?
Well, we ended up having normative data for firefighters. So if you want normative data for firefighters, we have that, which would be spot on for you. So the test we did on the Roman chair, because we're lazy, right? So the firefighters are more fit, like you alluded to. So if you do it on a table, it takes too long. So when we do it on the Roman chair, it's shorter, right? So we have normative data at 0 degrees, Roman chair. But from there, then we're actually studying a lot of the things that you're doing. So we should definitely now be I don't want to keep going on and on and on because it's exciting for me to see this. But did they get I would imagine they got funding from the Wellness Initiative to start this?
Yeah, initially, and now it's part of the budget.
Okay, exactly. Otherwise, I would say we could help get funding, but once they get funding, you only get it once.
Yep.
Rick was asking if other fire departments adopted the same program.
Most fire departments follow the Wellness Fitness Initiative. Some are more motivated than others. So it just depends on when you go to conference and you talk to other departments. I think ours had the most professionals involved with it because we had, at the time before Phil went to school, we had an athletic trainer. I'm an athletic trainer, physical therapist. We had a registered dietitian. I think we had a personal trainer. And most of them don't have that degree of professionals involved with it. Sometimes it'll be a PT clinic. But again, some of it's a cost perspective too, Joe, like you were alluding to. If they don't have the money to fund it, then it's basically like, hey, who wants to do this? And maybe a firefighter or engineer picks up the baton and runs with it for a little bit.
Yeah, to get funding, you really need somebody to help you write that grant because it's very scientific and it has various components. And one of the things that you'll see is Jim is spot on. Some fire departments are motivated, others aren't. Believe it or not, if you haven't had funding for this, they will provide funding if you request it. But a lot of fire departments don't want to deal with it. They don't want to deal with anything extra. So, we met with Temecula. They didn't want to deal with it. They didn't care. They didn't want to get $1 million free money. That's how much they would get awarded to implement it.
Well, all it takes, Joe, is, and the way this program got started, another physical therapist mentor of mine came and approached me with it. And I started Oxnard in 2001. And then Ventura City came down and covered and saw the firefighters going through our stuff. And we're like, hey, what's that? And then I treated the Ventura City fire chief. And he saw a couple of the guys coming in when I was treating them. He goes, we got to get this in our department. You know, so sometimes if there's a neighboring city, then the guys talk and kind of say, hey, you guys got to get this. And that's how we got that contract as well.
No, this was great stuff. And the nice thing about it too, if Jim can do this with firefighters and we can do this, you can certainly do this with patients too, some of the components for treatment.
Good deal.
Great. Any other last questions before we sign off? All right. Thank you guys so much.
Thanks, John. Good seeing you, Joe.
Good job, Jim and Phil.
Thank you. Good job, Jim. Awesome,
Wonderful.
guys.
Good job.